Health Equity and Wellness Forum hosted by the Connecticut Sun in partnership with the Connecticut State NAACP Youth and College Division. I am Dejanay Carrington, a second-year player for the Connecticut Sun. I graduated from Stanford University with a double major bachelor's degree in African and African American Studies, as well as psychology. Today, I'm joined by Patrick Green, President and CEO of L&M Healthcare and Executive VP of Yale New Haven Health. Also, Taretha Green, psychotherapist, consultant, and proprietor of Healing the Mind and Soul, and Destiny Jenkins Rubens, President of the University of New Haven NAACP College Chapter. So just to remind you all, this forum will be recorded so you guys can go back and watch and, relearn what we're going to discuss today. But I just want to give a little introduction of our panelists today. So first, starting with Patrick. Patrick has over 20 years of leadership experience in large nonprofit health systems and academic medical centers. He has demonstrated expertise to ensure operational integrity while developing sustainable business models. Before joining Yale New Haven Health, Green was Senior Executive Vice President and Chief Administrative Officer of St. Anthony's Hospital, a level 1 trauma center in Lakewood, Colorado. In addition to running her business, Taretha is also a mobile crisis clinician at Wellmore Behavioral Health Clinic. She earned a bachelor's degree in human services. Excuse me, y'all. I'm sorry. She earned a bachelor's degree in human services from Springfield College, a master's in community psychology from the University of New Haven, with a major in clinical services, a 6-year advanced degree in counseling from Southern Connecticut State University. Taretha is well known throughout the city of New Haven for her previous work at the Children's Communities Programs and Clifford Beers Clinic. And she has demonstrated her commitment to and knowledge of the families within the greater New Haven community for over 25 years, working with families exposed to trauma, domestic community violence, and sexual abuse. Lastly, we have Destiny, who is currently a senior at the University of New Haven, majoring in international affairs. In their time at the university, they have been a sustainability liaison, formulating conversations on campus towards sustainable green practice. They are currently the president of the university's NAACP chapter, addressing campus-wide social and political issues, as well as educating, empowering, and uniting the next generation of student leaders. They are also a justice, equity, diversity, and inclusion ambassador for their college, Henry C. Lee College of Forensic Science, fostering an inclusive campus community. So let's get into tonight's discussion. This year's Black History Month theme is health and wellness. The two main topics we will be discussing tonight are mental and physical health in the Black and Brown communities. At the end of tonight's discussion, we will open it up for a Q&A from you all, the audience. If there are any questions along the way, please feel free to put them in the chat and we'll try to get to them at the end. But we're gonna first start with Taretha, followed by Patrick. Before diving into our specific topics, I'd like to touch upon the importance of holistic health approach, as well as define health equity for people. So Taretha, as a licensed professional in the behavioral health sphere, can you explain what a holistic health approach is and why it's important to consider? And then Patrick, can you follow up and tell us what health equity is for those who might not know? I think you're muted, Taretha.
That always happens. Hi, and thank you for inviting me to be on this piano. Holistic therapy is not the traditional therapy. So we treat traditional, but more so we look at the mind, body, and the overall mind of how we look at things. You know, we look at if someone needs medication, but that's not the first thing we look at. That's like if we just totally exhausted
Mhm.
everything when it comes to, you know, looking at where a person is in their maybe trauma or just some things going on in their life. For instance, you know, we look at, okay, is there something else happening? Because usually the traditional is just kind of looking at the surface, which is usually like anxiety, depression, but the overall part is to look at the mind and soul, like what is driving these symptoms and how we can best work on them so that you don't have to, if you do go on medication, you don't have to be on medication. So it's really looking at everything, the whole being of the person.
Yeah. Patrick.
Thank you, Dejanay, for hosting this great forum and the Connecticut Sun. I'm happy to be here, and thank you for this question. You know, we define health equity. It's really focused on social and structural drivers of health.
Mhm.
And it means when everyone has a fair and just opportunity to be as healthy as possible. However, it requires removing obstacles to health, such as poverty, discrimination, and the consequences that come with those obstacles, including powerlessness, the lack of access to good jobs and fair
Yeah.
pay, quality education, housing, the environment where people live. We'll talk a little bit later about how one's zip codes matter, and as well as the access to quality healthcare. So that's how we define health equity.
Yeah, I know. I mean, myself, I appreciate that because a lot of times people confuse equality and equity. So that's very helpful for people to know the difference between the two. And I want to stick with you, Patrick, for right now. There are many factors that influence an individual's level of health, as you were discussing, including finances, access to affordable, nutritious food, and even where people live. These factors are known as social drivers of health, and they determine about 80% of our health outcomes. So, as a hospital leader who cares for these communities, can you describe experiences that you have had on the front lines helping people with negative health implications as a result of these factors that were aforementioned?
Absolutely, Dejanay. And it's one of the reasons why I chose this profession, because we know our staff, our physicians, our nurses, to be in healthcare, you have to have a calling to help others. And I know growing up in my neighborhood, you clearly saw the disparities in care. So being in the healthcare field, in our emergency departments, you see where a lot of these structural drivers of health, that as you described, have a negative impact on minority communities. Number one, as we talked about, education, having access, and just being able to prioritize healthy food, being able to afford healthy food, making a decision whether to pay your bills or medication. We know there's also a lack of trust in minority communities in health. So one of the things that we're trying to do is build a workforce, recruit a workforce that looks like the communities we serve. But unfortunately, we see a lot of challenging health issues like high blood pressure, diabetes, obesity in the minority community, and they don't have access to primary care. They may be underinsured, and so they seek care in our emergency department, which is not the place to receive primary care. And then things just just exacerbate from there. So what we're doing is investing in the communities, investing in affordable housing, investing in food programs that give people in these at-risk communities access to healthy foods. We continue to look at how we work with the local municipalities to invest in safe places, green spaces for people that can look at improving their lifestyle. We're looking at employing people, making sure they have a livable wage, doing training and development. So I'm proud that Yale New Haven Health has made a commitment to really advancing the health of the communities we serve.
Yeah, that's super important. There's so many different drivers, and I think one thing that you mentioned that stood out to me was trying to make um, the people who are serving us look like us. I know that just provides a level of comfortability and just a level of trust that is kind of an unspoken thing. So I really appreciate that. The next question is for all three of our panelists. What are some strategies and ways that we can approach addressing these issues to help end what appears to be a continuous cycle of cause and effect? We can start with you, Destiny.
Um, I think that some strategies that we can use to approach this is first acknowledging the issue and how it's so much more diverse than just like what we look like, because it's also, like you said before, like where we live, and
Mhm.
also like our financial levels, and things such as like COVID change our financial levels in so many ways, especially like our income. And like as a college student, that affected my financial aid, which affected how I was able to afford housing on campus, which means I had to live off campus. And um, it became a lot more difficult to, live on my own, and also figure out how I would be able to um like food options were able available to me. So for me, I think like we need to be able to acknowledge these issues and acknowledge how they impact these communities, uh, our community especially, um, especially starting with like the small thing as like financial aid. How can we increase that in order to help students?
Yeah, Taretha.
I think it's exactly what Destiny said, just kind of acknowledging that all these things are hinders to your mental health, you get in the proper, health care. For me, as a clinician, it's important for me to be able to be in a place where people, have access to me, meaning, I'm on the bus line, meaning I meet people
Mhm.
where they are, and that's important. Everybody don't have cars, everybody don't have appropriate transportation, and so when someone needs that, those services, I want to be accessible to them. She's absolutely right as far as like your medical and your financial status. That what plays a role. Um, a lot of our clients, I got into private practice because of a lot of clients, in the urban areas do go to clinics. But when you go to clinics, there are a lot of interns there. And I don't have anything against interns. I was an intern before. But the thing is, they are interns, and at some point they leave. And so, that affects, some of our clients who already had abandonment issues, and, just what
Mm,
people coming and going out their life. And so I thought that it was important for me to be a clinician that's available for the most part all the time. And so those are the things that matter. And those are the things that we have to address in our community. And a lot of people in private practice don't take husky, or they don't do sliding scale fees. And so I think that's important in our community. When you talk about cause and effect, these are the things that causes people not to get the services that they need.
yeah, absolutely. Patrick, if you want to add anything else also.
Yeah, I can build off of both Destiny and Taretha. We uh, believe that we have a responsibility to the community to go outside the four walls of our healthcare facilities, make those investments, partner with organizations like the NAACP, like the cities, other organizations, to make those investments, um, so that we are doing our part. And I think what we have to do is continue to use our voice, advocacy, work with our legislators to put in policies to ensure that we are lifting up uh, are most vulnerable in our community. But partnering with businesses, partnering with people, banks like Chelsea Grant Bank, they make a significant investment in affordable housing programs in the city of New London and throughout the state. There's many others, so I can't name them all. But I think as business leaders and in a role like mine, we reach out to various businesses in the community and try to develop that strategy together, because no one organization can do it alone. But I think we have to make a commitment to do our part, and also bring those individuals into our organization for job training, ensure that they're going to have jobs where they grew up and where they live, and make those investments. But it really comes down to education and also giving people access to not only care, but also the ability to support their families on a livable wage.
Yeah, absolutely. Thank you, all three of you. I want to come back to you, Destiny, and it's something you kind of touched on already, but as a college-age student who works hard addressing social and political issues on campus, have you seen ways in which any of these social drivers impact the college community? I know you touched on it with just your living situation and financial aid and things like that.
Also, yeah, I think it's been a big change for a lot of students to be able to go back to school who either have not had a college experience at all, or who had a college experience prior to COVID and are now coming back and have to deal with the limitations, restrictions, and all of that takes a toll. And on top of that, even when I talked about like the food restrictions, like there are even some religious groups on campus that might not be able to eat some of the food, and that affects you because you're not able to actually be in a community that you feel is inclusive of who your identities, and that's and on top of that, like because of these financial situations, your access to education has depleted, and it's so frustrating that you have to go and pay all this money to a corporation at that, and have a limited education, and they expect you to go out and have all of an education in which you would have if you had two years ago prior to COVID, but now everything is limited, so you don't have that same access to education.
Yeah, absolutely. Absolutely. I'm right there with you. I was in college before COVID and right as COVID hit also. So I know exactly where you're coming from with that. And this next question is for all three. Once again, in a community health needs assessment provided by Yale New Haven Health and Health Improvement Collaborative, it shows that those reporting low-income Black African-American residents of the greater New London County account for 25% of individuals with diabetes. And I know this is something that Patrick, you touched on, and 37.5% with hypertension. What can we infer from this statistic, and what can we learn from it?
Well, I think I can start. When we look at our community health needs assessment, the results are pretty clear that residential segregation is really has caused some damages to really have driven those results, where you have life expectancy difference in 5 to 7, even 10 years, just in a 10, 15-mile radius. And those lending policies that really have forced minority communities to live where no one else wants to live, quite frankly, really has damaged some of the health inequities that we see, where, again, not having access to healthy foods, not having access to schools that help educate our communities. That's what a lot of that is driving those results, Dejanay. So I think that's what we as a community have to do together, is stand up and really try to work with our legislators to put in policies to change this trajectory. When you go into certain neighborhoods, you're going to find
Mhm.
more fast foods than organic
Exactly what
food
I was
deserts.
thinking about.
You're going to find liquor stores more
Yeah.
so than where you go to a neighborhood, again, 10, 15 miles away. None of that's anywhere. The municipalities won't even allow businesses to come in and make those investments. So I think we have to start and make a commitment collectively to start addressing, centered around my eyes, residential segregation. I think home ownership could change a lot in that regard.
Absolutely. Absolutely.
I think the statistics, like Patrick said, it shows for itself. Like there's really, I think someone talked about the zip code, right? I think it was Patrick talked about the zip codes earlier. And it does determine, what type of access you have to medical treatment. But what people also don't know is from a mental health standpoint, I get a lot of clients that do have hypertension, diabetes, and they're affected, mentally because a lot of them don't, know how to take care of themselves. They don't know, can they work and be, functioning at work, or just the thought of getting the right care because the medications cost too much. That causes stress. And so the numbers are extremely high. And when you talk about, affordable housing, I know we're going to touch on that later, but I think that has a lot to do with this question. You don't have affordable housing, you don't have steady housing, you can't cook, properly. You can't, buy the proper foods to store. So, or don't have the storage to put the food in. So all these things matter. And if you don't have the money, the access, it causes these numbers to be extremely high.
Yeah, just to add on to what Patrick